Hello everyone, my name is Vihaan Gehlaut, and I will be presenting on the case of cholera. To start, I'd like to share some things about myself. I'm a rising sophomore at the International Academy East in Troy, Michigan. Outside of academics, I enjoy playing tennis, practicing piano, and planning and leading events through my school's student council. Furthermore, I am the secretary of the Teen Advisory Board at the library and serve as the vice president of the chess club at our school. I find joy in the various aspects of medicine, and I aim to be a physician. Global health, as we all know, cultivates an opportunity of better healthcare for all. Yet, when illnesses and problems are discussed, they tend to exclude certain voices. Such is the case for cholera. In Africa, where the majority of cholera cases lie, many residents are unaware of how to battle the disease entirely, and I aimed to help those people. But before I tell you about the initiative I took, I will be sharing details about this global health issue. Today, my aim is to not only illustrate how detrimental cholera is in a global context, but to also display, through the work that I have done, how all of us should play our part in combating it. Cholera is a bacterial disease caused by the bacterium Vibrio cholerae. Vibrio cholerae is a gram-negative bacteria, meaning that it has an impenetrable cell wall, allowing it to resist antibodies. Additionally, it requires salt for growth stimulation, which is why the bacterium is found naturally in coastal water. Vibrio cholerae infects one's intestine to cause cholera. The bacterium does not spread from casual contact, but it can be found in the feces of an infected individual, and subsequently in food or water contaminated by it. In places with inadequate water systems, this creates a cycle. Illness occurring from consuming something contaminated and continuing to spread. The domino effect worsens as every person is susceptible to the illness. The impacts of cholera lie in the symptoms that it causes. Typically, someone with the illness would develop mild or no symptoms. However, for the unlucky 1 in 10 who do develop symptoms, diarrhea is a relentless pain, and the resulting dehydration can be fatal. Loss of fluid-balancing minerals leads to electrolyte imbalance, resulting in cramps and potentially deadly shock. The primary treatment for these more affected patients is rehydration therapy, where they are provided salts and electrolytes through oral rehydration solution. If the case is very severe, patients are put on intravenous fluids. Other treatments include antibiotics and zinc for children. Now, let's look at the global effects of the disease. As the map displays, although it is rare in developed areas with adequate sanitation, cholera's immense impact on some countries, its ability to spread quickly, and severe symptoms it can cause make it a pertinent global health issue today. According to the International Journal of Travel Medicine and Global Health, cholera remains a global threat to public health and an indicator of inequity and lack of social development. After learning about this, I began conducting my own research on cholera in Nigeria and compiled it into a one-pager displayed here on the left-hand side. It was meant to educate and share with citizens of Bauchi State, Nigeria, who are affected by the disease but possess little knowledge on how to combat its detrimental effects. It was put up in the community as a source of information. However, through my research, I noticed that in such places with underdeveloped water systems, the effects of the disease are extreme. Since these drainage systems are not always feasible to advance, the one-pager revealed that the feasible, effective way to battle cholera is in fact through preventative measures. For confirmation, I created a survey for the community. When participants were asked questions, such as about their drainage systems or water availability, their responses tended to reveal that these systems are not always adequate, showing again that enforcing them is not the feasible solution. This again affirmed the need for primarily preventative measures. However, further inquiries disclosed that citizens were often unaware of these measures, as shown in this question, by the majority of respondents that did not understand the threat of contagious species. To address this outlying issue, I created a community workshop that would inform participants on how to fight this global health issue. With the title Handling Cholera Workshop, the project was designed to educate adults of the Gwalagan Makaya community in Nigeria on how they could effectively eliminate the threat of cholera in their individual households by preventing it from occurring at all. The workshop consisted of several different activities that all focused on different aspects of prevention. The first consisted of group discussions, the second activity was taught through a collective trivia game, and the final activity involved the creation of individual mini water filters that emphasized the importance of drinking only clean, such as well water. Furthermore, I created a take-home infographic for participants to further their knowledge to others. The workshop was implemented in Nigeria itself, with citizens being thoroughly informed about preventative measures as a result. Although my workshop is effective in combating cholera, I hope that this is only the first step in our aim of educating others about and using preventative measures to battle this illness. We all have a role to play in this process. If you are someone living in a cholera-prone area, prevention is the best choice, including avoiding seafood and contaminated water, washing your hands, taking the oral cholera vaccine, and avoiding affected individuals. If you are living in an area where cholera is rare, it is still important to follow preventative measures, especially when traveling to a cholera area. Make sure to advise such preventative measures in these areas if you can, in order to help spread the word. Contending with this global issue can only be done together. Make sure to remember, all in all, the best way to combat the spread of cholera is through preventative and precautionary measures. Keep this in mind as you move forward and always stay safe. These are my references. I'd like to give a sincere thank you to the Global Health Leadership Conference program at Johns Hopkins University for providing this wonderful opportunity. The Leadership Initiative's public health program, including Marshall Bailey, Umas Dram, Umar Muhammad, and the entire staff for guiding me through and providing a base for my work, my family for everything, and the audience for listening through to this presentation and learning how to combat cholera and the global dangers that it poses. Thank you.